How does that work? Hello?
Good morning, Wina.
Morning.
You know, to make the matter worse, they have even become the dictators.
Where are they like this?
In that group, you are not even allowed to comment. The only admin can comment, can post something.
Hold on, you're in a group that you're not allowed to comment in?
Yeah, you can't write an SMS. You can't reply. You can't ask any question. You see? You only follow the instructions that they have given you.
What do you mean?
I'm telling the truth. Sometimes they can tell you to bring something. You need to be nothing to be defined, you know. There's no way you can ask a question. What do you want? What type of drink do you want? You see? You only follow the instructions the way they have said. So they have become dictators.
Operational ward beds, over 30 specialists and consulting doctors. Tophil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy. Karibu Tophil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theater, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophil Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophil Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophilhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophilhospital.com.
Good morning, everybody. Wakey, wakey. It's time for Morning Glory. My name is MC Kalia, and I'll be your captain for the next 1 hour, 30 minutes. Let's have this conversation going. Good morning to you. Good morning to you. Indeed, it is the 25th day of January 2022, a healthy, wealthy, wise Wednesday. My name is MC Kalia, and welcome to the Morning Glory Show. This is the most comprehensive talk show in Kenya today. If you're tuned in, let me know you're tuned in. Of course, today being Wednesday, then we would want to improve our health education. Just want to improve what we know about health. And with us today is Oscar Mutwasi from Tophil Hospital, to help us understand the medicine of imaging, what we call medical imaging. Many people know it as radiology, but then I also realized that there are people who really, when we posted the poster, were asking me, you mean you'll be talking about radio on radio? So that means that actually, today we're just talking about issues of CT scan, MRI scan, and all that, just to understand when exactly does it happen. And then also I realized that there are a lot of theories about it today, so we really want to understand that. So as we continue, make sure that you ask those good questions. Mr. Mutwasi is here to make sure that all the questions are answered. So if you have any question about any kind of medical imaging, then make sure that you really ask it today on the Morning Glory Show. With that, allow me to give a chance to Bwana Mutwasi to introduce himself and say hi to you. Karibu sana.
Good afternoon, good morning, everybody. My name is Oscar Mutwasi. I'm a radiographer. For those people who have been interacting with us from those old days. But currently, the common name we are using is we are medical imaging technologists. Medical imaging technologists are those people who use radiation and electromagnetic waves, that is waves of very short wavelength in an effort of ensuring that we acquire some images from the human body, from the animals, and from there is that part of it which is called industrial imaging. For these images are mainly for diagnostic purposes.
Okay, thank you so much for that. Quite a powerful introduction there. So if you are there, you've ever gone through an MRI or a CT scan, then of course you would be able today to understand better what actually happened to you. But then before we go far, allow me to also remind you that we are coming live from Dawi Afrique Photography. Dawi Afrique Photography is a production house situated in Eldoret, Zion Mall, Basement A. So many people asking me, where is Zion Mall exactly? Of course, those people have not been into Eldoret, because if you've been to Eldoret, then Zion Mall is a landmark. Zion Mall is situated just opposite Barngetwin Plaza along the Eldoret Uganda Road, or rather the Nairobi Uganda Road. So if you're already, if you're in Eldoret at any time and you'd want to take those nice photos, feel free to pass by Dawi Afrique Photography. It is a family-friendly studio, enough space for everybody. So make sure that you pass by here to make sure that you are able to get those nice photos and memories documented. We call it at this place that is, we usually refer it as images beyond imagination. Remember that this show is co-produced by Very Nice Media and Dawi Afrique Photography. So with that, I think my first question to Bwana Mutwasi, first of all, of course, is maybe take us through the different types of imaging. So without explaining much, maybe what does medical imaging entail?
Thank you, Mr. Kalia. In this particular session, I will try in very simple words to really dissect and make the public understand what is basically meant by the word medical imaging. Medical imaging is a type of technology that is used in medical science, whereby mainly for the public to clearly understand, we call it radiology department. In radiology department, you come in, you will find quite a number of modalities which are called radiology equipment. Part of the radiology equipment, we have mainly, and the most ancient one is the X-ray machine. X-ray machine is a machine that has been here for quite some time, and basically it has been in use since the year 1896 when the use of X-rays were discovered by Professor Wilhelm Röntgen. It is basically just passing through radiation through a human body or through a particular volume, and on the other side you put there a film and you record an image on the other side. That is basically radiology, X-ray in radiology. That is where you will find chest X-ray, skull X-ray, small bones X-ray, joints X-ray, and so on. Further to that, there came in what is called ultrasound in common terms, but for us, we use the term ultrasonography. This is whereby we again use sound energy. We use sound waves to get to understand how the human body is functioning. Apart from X-ray and ultrasound, the third one in is CT scan. I know many people just know the word CT scan, but in full is computerized tomography. I won't go into details about computerized tomography, but in simple terms, I will say that computerized tomography or CT scanning is a mode of X-ray imaging whereby we use radiation. And when I talk about radiation, radiation again is divided into different aspects. You have, depending on the wavelength of those particular radiations, and that is what determines the strength of that radiation. So what we mainly use in medical imaging is X radiation. That is what is called X-rays. So for CT scan, we use X-rays to do what is called transsectional body imaging. Transsectional body imaging is where you get the human body in a particular position, and using radiation, you get slices of the human body, not practically slicing the body, but using radiation, the image you get gives you thin slices depending on the thickness you have selected as the person who is operating the modality, so that you can clearly evaluate the internal organs. Last but not least, we have what people would look at as the newest modality in the field, and that is by great magnetic resonance imaging. Magnetic resonance imaging, in short, many would know it as MRI. Now, we have to be very clear when we are talking about magnetic resonance imaging. This is a mode of imaging whereby we basically use a magnetic field and not radiation. In magnetic resonance, I repeat, we don't use radiation to acquire images of the body. And again, this is a transsectional imaging of the body, and we get human body in slices so that we can evaluate the internal organs. Why slices? You see, when you look at the human body as a volume, you are not going to be able to clearly understand what is happening inside. It is just like looking at a loaf of bread. When you are looking at a loaf of bread which has a coin inside, I want to talk about a coin inside a loaf of bread as the tumor I'm looking for. For me to be able to evaluate this tumor, then there is a need for me to slice the bread into specific slices of different thickness for me to be able to define the kind of a tumor it is. So that is basically what I mean when I talk about transsectional imaging of the body. And that mainly happens in CT scanning and MRI in all the standard X-ray department or radiology departments we have across the borders.
Okay, thank you so much. Quite a good explanation of what happens actually at a radiology department. And the first question that everyone asked when I put up the poster was, is it dangerous? That's the first question. Is it even safe? Would you advise it for? And maybe you'd have to go from one to the other, because people ask me about x-ray. Somebody saying our church doesn't support this and all that. What are some of these theories that you interact with in the hospital? And what are some of the facts that you'd want to put across, especially starting with x-ray?
Having practiced medical imaging stroke radiography for the last close to 25 years, that is half a quarter decade, I would say that I have come across all the theories that happen to be in the market. And the key word that each and every person is looking at, in whichever way they look at, we sum it up as safety. Safety is a keyword which is applied everywhere, and I will zero in on safety in medicine. Everything that is happening in medicine, remember, has gone through quite some research. And research has proved that it is safe to be applied in medicine. Safe in the sense that its advantages, not disadvantages, its advantages outweigh disadvantages. Before I go directly to radiology safety, I will talk about the general medicine we are using. That is why medicine comes into doses. Dosing in medicine is actually a safety issue. You cannot just take medicine because you are sick. You have to take medicine in doses. If you take more than what you are expected to take, then
it is a problem, of course.
You have done an overdose. And that is a safety issue. Going to radiation. Initially, when radiation started being practiced in medicine, it was like there was no specific prescription. As in radiation, we can say is like a drug I want to use. So it reached a point whereby there was to be a prescription. So as drugs are prescribed, radiation is also prescribed. It comes in doses.
Okay, so what this basically means is that the amount of radiation that you use from one patient to the other is different.
Definitely, yes. The amount of radiation I'm going to use on toe imaging, toe, I mean the toe of the foot, on a finger imaging, is not the same as the dose of radiation I'm going to use on the head or abdominal imaging. Each and every part of the body has doses. And remember, when we are talking about radiation safety, we need to seriously concentrate. I'm talking about medical imaging. We seriously need to concentrate on X-radiation in medicine, and that is X-rays and CT scan. That is where we use radiation in medical imaging. Ultrasound, we don't use radiation. MRI, we don't use radiation. I will talk about the safety in ultrasound and the safety in MRI later, at a later stage during the interview. But for now, I want to tell all my viewers that radiation being used in medical field has its advantages and disadvantages, but the advantages outweigh
the disadvantages.
Mm-hmm. You see, when you come for an X-ray, if you are a female who is in reproductive stage, we will always ask you. I have come across quite a number of young ladies and middle-aged ladies asking me, why do you want to know the first day of my monthly periods? That question is so important for us because we need to understand your circle and clearly ensure that we are not exposing a lady who might be in her early stages of pregnancy to radiation. Why? Radiation, however low doses they are, it has been researched and well found that it might cause some effects to areas which have got cells which are highly multiplying. And a very early pregnant lady has got very highly multiplying cells in her uterus.
Which is now the fetus.
Yes, that is, we start with the zygote, it goes to the fetus, and those are, because it is a highly growing area, then the cells there are highly multiplying. There are also other cells of the body which are very sensitive to radiation. And while we are doing radiation, we try to ensure that we concentrate on specific areas of interest. I am not saying that a pregnant lady cannot be exposed to radiation. Radiation, while using it, is only directed at very specific areas. So there are also other additional methods of ensuring that a lady who must be exposed and she's not sure whether she is pregnant or not must be well protected. And not only the pregnant ladies, even the general public. We also don't want, it's just like you are suffering from malaria, you are taking malaria drugs, and you want somebody else who is not suffering from malaria to take the drugs. It cannot work. Drugs must only be taken by the people who are entitled to them. Likewise, radiation can only be used to people who are to be exposed to it. The other people, we call them the general public, and we don't want to expose them. So we only, even if that particular individual we are exposing radiation to, we only expose to a particular region which has to be irradiated.
Mm-hmm. Okay, thank you so much. Of course, quite a good explanation. If you're following this discussion, remember that this is the Morning Glory Show coming live from Dawi Afrique Photography. With us today is Oscar Mutwasi from Tophil Hospital. And I told you that for a few weeks we'll be getting health education from doctors and experts from Tophil Hospital. So that means that actually, if you're already tuned in, make sure that you tag in your friends. Today we are talking about the issue of medical imaging, and I can see Alfred Sargent saying he's tuned in all the way from Itigo, Nandi County. Sami Lagati saying he's tuned in from Kapsoya. Thank you so much, Sami Lagati, for always making time to be with us. Mildred Sum says she's tuned in from Zanmol. Thank you so much. Chris Samoe says tuned in. Anthropology saying he's following all the way from Laboret. Thank you so much. Tag in your friends, as many as possible, and let's continue to have this particular conversation. Today we are talking about, or we are trying to understand radiology. Bwana Oscar, they are explaining each aspect of it. We are talking currently about safety in CT and X-ray, which actually is confirmed to us, that our expert today has confirmed to us that they actually use radiation. And I noticed that so many questions about radiology still coming. In fact, there's somebody who is still asking about a quite interesting question here. I think, what actually happens during an X-ray? You notice there's also still a question that pertains around safety. Another question here saying, is radiation from an X-ray dangerous? You notice same question around safety. And Dr. what are some of these theories? Yes, of course, we'll call them theories, that you really want to dispute them today, because I'm sure you've said you've interacted with quite a number. What are some of those common ones that you'd want to actually advise people upon today?
Okay, I will go directly to answer that first question, where somebody has actually asked, what happens during an X-ray? In short terms, what happens during X-ray is a beam of radiation is directed through a mass which has got different densities or different volumes, and the radiation that is directed through a mass exits on the opposite side of the volume. And immediately after its exit, we have what is called a film or something behind which records the exit beam of radiation. Now that exit beam of radiation, you will discover that once it has interacted with the matter that it has gone through, where there is a bone will tend to absorb more of radiation. It is just like when you have a paper with different densities or different colors or with different opaqueness, and you direct a beam of light through it. Then you will discover that on the other side, the clarity of the light will appear differently. So it is the absorption of different parts of the body that provides the exit beam of radiation, which is captured by the recording device, then through the normal processing. Now you go back to photography, the normal photography, you process that image and you get an image with different densities. Suppose there is a tumor in that abdomen, also that tumor will tend to absorb radiation in different ways. So there is the standard normal appearance of a normal area of a human body and
without
the abnormal, without a tumor. And when you look at one which the tumor has interacted with radiation, then you are able to see that there is abnormality here, and that is what is called positive identity of a disease process or diagnosis.
That actually has come out quite clearly. So actually you guys are also photographers, I think.
Of course, during my training, I had a whole part of my syllabus was photography.
Yeah, because I realized actually all you're doing is just film production. Anyway, if you're already tuned in, we're coming live from Dawi Afrique Photography today, talking about radiology. Dawi Afrique Photography is a production house based in Eldoret at a place called Zion Mall. If you're in Eldoret and ask for Zion Mall, I'm sure somebody will be sure to direct you here. If you need anything that goes into video or photo production, then be sure that you will get it here. Next question, of course, still around radiation is there different ages that you can expose to radiation? And also when you're doing radiation maybe on a child or an adult, are there differences? And also is there ages that you don't also advise somebody to undertake or go through radiation? Of course, you've talked about the issue of also different doses of radiation. Is there any difference between exposing radiation to a child and to an adult, and what is the difference, if there is?
I'll try to answer that question precisely, but before I go there, something I might have forgotten to tell you is that we have so many divisions in radiography. Initially, the radiation practice is divided into therapeutic and diagnostic. Therapeutic is for treatment, diagnostic is for finding disease. Going further, I will leave therapeutic for another session maybe. I will come to diagnostic, where I have been all this time. Diagnostic, again, goes further to other areas. That is where we look at ultrasonography, magnetic resonance imaging, CT scan. There is what is called, again, nuclear medicine and many other forms of applications. And again, in this diagnostic, people would wonder, diagnostic is for human, a living human. Again, I want to define for myself, diagnosis is what Dr. Johansson Oduor, the chief pathologist, government chief pathologist, does. In my colloquial terms, I would want to define it as diagnostics, because you are trying to find out what happened
to this person,
to the death of this particular individual. There is radiography in that. Radiography is also practiced in dead bodies. Radiography is practiced in veterinary. So the purpose is the same, to find out what is happening in this body. So we have to go back and zero in now to diagnostics of disease in living human bodies. Let's do away with the other forms of radiation practice. So you talked about ages. Remember, initially I talked about the word actively or spontaneously dividing cells. Growth is all about cells dividing. We try and ensure that I would think twice to expose a newly born fetus to radiation the way I would think to expose a 21-year-old adult. The key issue here is that actually radiation tends to kill cells. And radiation, a cell which has just been divided is a young cell. A young cell is very sensitive to radiation. So that young cell can tend to die to very low doses of radiation. But remember, the body keeps on generating cells, however young or however old they are. Even if you are 100 years old, remember you are living because as much as your cells are going, the body is generating more cells. It's only that the amount of cells and the strength of cells differ. But age is a key factor, particularly when you are looking at the anti-age. And when we talk about the anti-age, here I simply mean as you start from day one of your life on earth, moving up, we really seriously make considerations before we do an X-ray. It must actually, the disadvantages have to be clearly understood and ensure that the advantages outweigh disadvantages.
Okay, we make sure that the advantages actually are more than the disadvantages. The next question, of course, would be still around. Now, let's talk about I've seen so many people. There's a post here about faith and all that affecting how people perceive X-rays, especially now that you've said it actually happens majorly in CT scan and X-ray. Is there any other way then of getting diagnosis without going through radiation, especially when you want to get what is happening inside the tissue? Because what happens to patients who have full reservation about it?
The decision on which kind of modality to use for diagnostic purposes is judged upon by the clinician who is seeing the patient, and the person who is to do, or rather, to use radiation on that particular patient. Quite a number of considerations have to be done. At times, we have those clinicians who believe that I have to use the highest technology because the insurance is there, or rather, this is the highest technology, I want to get the finer details. At times, we reach situations whereby we normally say no to it. A very good example is I have an option of, if my leg is fractured, to do a CT scan to find out how the fracture is. But at times, we normally say you are looking for a simple fracture. CT scan, of course, has higher radiation than general X-ray. You can see your fracture through an X-ray. So we give that advice. At times, we even reject doing that procedure. Remember, there is another principle in the practice of radiation, which is, in short, it is ALARA, ALARA. ALARA simply means it is a direction that has been given by the International Atomic Energy Institute, which is an organization that monitors the use of radiation worldwide. So, ALARA simply means as low as reasonably applicable. The key word there is now reasoning. Reasoning is the reasoning of the person who is going to make that exposure of radiation. You have to be reasonable and ensure that are you using the lowest amount of radiation that is going to give you the best energy, the best image for diagnostic purposes. So that is very important in the practice. And when you talk about different modalities to use, actually we have to be very considerate. There are different modalities which can give you the same diagnosis, but you have to look at a number of things. The radiation doses, and again there is that finance aspect of it. As we move up from X-ray, CT scan, MRI, the prices keep on changing. But I know at times we do overboard things and we want to use the top of French modality that is there when we can get a clear result just with a normal X-ray.
So it is very important that when a patient walks into a hospital and they have been told to do a certain, maybe CT, they can also ask if an X-ray or something may work for them.
Yes.
It is advisable to do so.
Yes, it is advisable. And again, just to try and loop in the other modalities, when we are talking about diagnostics in medical imaging, there has been this notion that if I want to get the best image, I have to go for the top range imaging modality. That is not the... Each and every modality has got where it does best. There is a place where X-ray is the best, where CT cannot give you the best results. MRI can give you some specific results for specific areas, not all the areas. So a specific imaging modality has to be prescribed depending on how are you going to get the best results. And that is why at times you come in for an MRI. There are a number of cases I get patients coming in. My doctor has requested me to do an MRI of the chest. I will, when you are asking a patient to come to me to do an MRI of the chest, I will simply tell the patient it's not possible. Because MRI will be good in areas where there is minimum air. I hope when we will be talking about... Of
course, we'll talk about MRI.
MRI, you will be able to understand. So, each and every modality has got its purpose in medical imaging and diagnostics. In a nutshell, that is what I can say.
Of course, I believe that we've conclusively talked about MRI and CT scan, unless Bwana Oscar will be having something to add. X-ray and CT scan. But then, of course, if you tuned in and if you just joined us with us today in studio is Oscar Mutwasi, who is an medical imaging technologist, just helping us understand different diagnostic imaging technologies and also trying to advise us, trying to dispel some of the theories and some of the, I would say these are just safety precautions that maybe people would want to take without necessarily understanding what exactly that means. A question here that somebody has asked is, ask the guest to differentiate between CT with contrast and CT without. What does it mean and why is one more expensive than the other?
Now, CT with contrast and CT without contrast, actually the difference is in the similarity. Because CT with contrast is actually a CT with contrast. CT without contrast is a CT without contrast.
So maybe you may be defining contrast here.
Yes, what I need to define here is contrast.
Okay.
Contrast is a chemical which is injected into a human body to try and define more a disease process. There are different types of contrasts that are injected, but I know this particular patient wants us to understand the contrast that is injected into the vein when we are doing a CT scan. And that contrast is why it is more expensive. It is more expensive because that is an extra thing that is being added to that is an added value to the examination. And value addition has got a cost implication because that contrast is not cheap. Anyway, going back to the contrast, what is this contrast? Contrast is, let's say, a drug. It is, many patients will call it a dye. A dye is something that changes the appearance of something once it has been introduced into that particular something. When I will use tumors, most patients undergoing some of these procedures, like CT scan, we are suspecting tumors. And again, it's not that anytime I give you an injection, you have a tumor. That is not the case. I just want to rule out the possibility of having it. There are those cases whereby patients have undergone surgeries for removal of tumors, excision of tumors. And the doctor wants to find out, is there a recurrence or not? So we give an injection to see if there is a recurrence or not. What happens when an injection is given of contrast or dye? Without injecting, you will look at that image and you will not be able to see the blood supply for CT scan, not for MRI, for CT scan. There is contrast in MRI that is totally different. Contrast in CT scan defines the blood supply mainly. And I would want to say this. Areas which have got abnormality naturally, because, you know, white blood cells in the body fight infection. So naturally, an area with infection will have a higher blood supply. So when I give that injection, I want to differentiate the supply. Of course, there is that normal blood supply, which we know. But when I give the injection, now I will see that this particular area has got a high blood supply. Tumors, you will find out that tumors tend to have very heavy blood supply. Some of the tumors tend to have very heavy blood supply within them. So it also enables us to define which kind of a tumor, because again, some tumors are defined with the kind of blood supply they have. So basically, that is why we use contrast. And again, the particular area depends on the amount of contrast we are going to use. Now, something very important. Patients come to me, I send them to do an examination before I put them in the machine. This examination is called creatinine. We normally just tell them, go to the laboratory and do a creatinine examination. Creatinine is an examination which is basically done to define the kidney function. The kidney function has to be determined because whatever dye I'm giving you has to be removed from the body. And how is it going to be removed from the body? There are so many things. For those who take alcohol, I wish I take alcohol, I would be knowing. But for those who take alcohol, they say that is why each and every time they go to the toilet, that alcohol, the poisonous part of it has to be removed. How? By the kidneys. So there might be the 10% stuff remains in the body, what is important to your body. And even the food we eat, quite a bit of it is poisonous. It has to go out through the intestines or through the kidneys. The contrast I'm giving you is poisonous to the body, a part of it. But that poisoning aspect is also important to me because it helps me to define the disease process. But that poison, God created us in a very special way. The poison is removed by the kidneys. So I have to define the functioning of your kidneys clearly so that I know once I've given you the injection, it will be removed by the kidneys. That does not mean that if you have partial impairment of your kidneys, I will not give you the injection. There are a number of precautionary measures I take. Once I give the injection, there are some instructions I will give you to ensure that that stuff is removed from the body. And also there are some precautionary measures we do to ensure that we achieve some level of kidney functioning before we give you the injection.
Okay, thank you so much for that. So you're currently tuned into the Morning Glory Show, the most comprehensive talk show in Kenya currently. If you're looking for to be edified, then the Morning Glory Show is the place to be. With us today is Oscar Mutwasi, a medical technologist from Tophil Hospital, helping us to understand medical imaging technology. Of course, before we go far, allow me to remind you that Tophil Hospital is a level 5 hospital situated in Eldoret, Elgon View, just around Bomain area. It is a hospital that has actually specialized a lot when it comes to brain and spine, but then be sure that you'll also be able to get other services apart from just maybe mitigating cases of issues to do with brain and spine. They have a radiology department. Of course, you can see a radiologist here. They have a physiotherapy department. They have a cardiologist. They have other, they have neurosurgeons and very good consultants in there. So if you're thinking of a place maybe to direct your medical cover, then consider working with the Tophil Hospital. Also, in addition, of course, is you'd want to look at the serenity of where it is situated, especially if it is a patient that they'll be, if admission may be prescribed, remember that it is in a place that is actually quite cool and nice for recovery. So just to continue educating us with us here is Oscar Mutwasi, who is a medical I would say it is medical imaging technologist, what we used to call them radiologists, but then it's actually defined that right now the precise term to use is medical imaging technologist. Quite a mouthful there. So if you tune in, of course, let's continue engaging. And my next question, of course, we would want to get into other technologies that do not involve imaging and rather radiation. But then before we go there, are there any other precautions or things that patients need to tell you, apart from pregnancy, of course, you've talked about, and the kidneys? Are there any other precautionary measures that go into before making a decision, especially when it comes to x-rays? And of course, what are some of the things that I need to tell maybe the clinician or even the radiologist before going through a particular imaging procedure?
Just a correction before I proceed. Initially, it was actually the professional was called a radiographer, not a radiologist. Radiologist is something, radiologist is some higher position preferred to some other individuals. I will not go deep into that, but for us it was radiographers. But when the other modalities came in is when we turned to medical imaging technologists. Now, safety measures are very important in medical imaging. I talked about pregnancy, and that is all about the menstrual cycle. I won't, again, go back there unless another special question comes in. Now, there is something which very important we normally get from our patients, and that is allergy. Particularly those patients whom we are going to give contrast injection. Allergy is basically reaction to something, not necessarily a drug, but here we are only looking for an allergy to a reaction to a drug. Some of these reactions can be mild, others can be very bad to the patient. So we must, if there is any we must ensure that we put, whether they are there or not, because actually an allergy only is experienced once you go through something. So for us to know that you are allergic to iodine,
then you would know after
you know
iodine
after.
has been exposed
Yes.
to you.
So either side, in any radiology department, there is that emergency preparedness in case of an allergic reaction. But for those patients who have allergy, they normally inform us. How do they inform us? Prior to these examinations where we suspect we are going to give contrast injection, or when we reach a level that we have to give contrast injection, depending on the amount of contrast injection that we are going to give, there is a consent form that has to be signed where the patient is clearly explained to. The patient is explained about the contrast and the reactions that can happen, so that the patient gives us the consent to give or not give. Thank you.
So much. I think we've conclusively tackled the imaging that requires us to use, or requires the radiographer to use radiation. So we've talked about X-ray. We've also talked about CT scan. So Oscar will be taking us now to technology that does not require the radiographer or the imaging technologist to use radiation. These are words that we are not used to mentioning daily, so you notice that I actually have to go slow just to make sure that it doesn't have to give another correction. So of course, if you tuned in, we are talking to Mr. Oscar Mutwasi from Tophil Hospital. We've talked about X-ray, we've talked about CT scan. When Oscar Mutwasi, what next?
Let's talk a bit of this common modality that is called ultrasound. Very common with expecting ladies. First of all, the information I want to give you is that ultrasound is not only for expecting ladies. Ultrasound is a modality that is widely used in medicine to define other illnesses. Of course, the majority of it is to define the well-being of the expected baby. So it is the use of ultrasound waves. Just as I said, there is something which is used to generate an ultrasound wave of very short wavelength, which is directed at a specific place of the body. It goes through, depending on what is in the direction of the beam. That is the direction of the ultrasound wave. Then, on the other side, the exit, we will be able to analyze the strength of what is coming out. Then we define what has the wave interacted with for us to get the exit beam. Look at a wave in a river that has just hit a stone, a huge stone. Then you are on the opposite side. What you experience is not what somebody who was standing directly in front of the stone before the wave hit the stone experienced. So it is actually what is obstructing the wave is what is called defining the disease process or defining the area that is being scanned. So an ultrasound wave is taken through a pelvic of a lady who is pregnant, and on the exit wave is analyzed on how it is that wave is interacting with whatever it is meeting. Then normal areas have already been defined earlier, abnormal areas will be found, and now, like for the pregnant lady, it will give an image. It defines, it analyzes and gives an image in the way you have selected. There is even now what is called 3D, there is 2D. 2D is whereby you just look at the image in 2 dimensions, left or right, front or anterior. Now, there is the 3 dimensions, and there is up to now what is called the 4 dimensions. 3-dimensional imaging, you know it even in photography. There is 3-dimensional imaging, but for the listener, 3-dimensional image is now, it happens in CT scan, in MRI, in ultrasound. That radiation that has taken, that beam of ultrasound wave radiation that has been taken through a mass is analyzed to build a volume. Now, instead of slices, now it concentrates these slices together and gives you a volume. Like if it was the head, now it brings the slices together and it builds the head, the whole head. You can be able to look at the whole head. That is what is called 3-dimensional imaging. Very many patients ask, what is 4-dimensional image? There is another aspect that has been added on 3 to make it 4. And that 4th aspect that has been added is like a functional aspect. What is the functional aspect? For those who have visited an ultrasound center when you are pregnant, you will see the person doing the procedure telling you that you see the kid is now suckling the finger. You see the kid is now passing urine. Of course, they urinate even when they are in there. You see now the kid is moving. Now that is the 4th dimension. Now,
You can see just beyond the image.
yes. Now that 4th thing that is happening, what the kid is doing, that is now the 4th dimension. You see now, I have built the kid, the fetus in the uterus. You can be able to see the fetus on the screen, but now you are seeing it suckling the finger, passing urine. You understand? Moving. Now that is the 4th dimension. So, that is 4-dimensional imaging is mainly done in obstetric imaging. Going back to general ultrasound. Ultrasound is mainly a soft sectional imaging, whereby it is meant to look at the soft organs, the soft areas of the body. Defining a bone becomes very hard because actually ultrasound wave will not even be able to go through the bone to be analyzed on the other side. But for soft imaging, at least it goes through, then it is analyzed on the other side. You know, for imaging to have happened,
It must
produce a result because an analyzation has to be done on the other side. If you get something, if you get 0 image on the other side,
then there is nothing done.
Yeah, there is nothing which went through. So that is basically what is imaging is all about. So you have like the liver, the kidneys. We have, apart from the heart being located in between bones, those are the ribs, there are specific areas where you can go through soft area just below the ribs and just above the ribs up here. You can go through and be able to look at the heart. That is now called cardio imaging. The liver is right up there. The stomach is right up there. The pelvis is right up there. You can reach the pelvis easily. And there is also what is called small parts imaging. Small parts imaging is that you see even the knee, apart from the knee being bony, there is in between the knee which has got fluid in it. So there is that ultrasound of the knee. So that is called small parts imaging. You have areas like you might have, even on your thigh, there is the flesh aspect. You can do imaging to look at if there is a tumor there or not. The shoulder, you can do a shoulder. Just going through the space, you can be able to define if there is excess fluid, if there is a torn ligament of the shoulder, the knee joints, or the joints. You can do an ultrasound to get that image. Safety in ultrasound. Ultrasound is an imaging modality which is very safe. You can do it to anybody. The only safety that happens there is the physical safety. Might be you get a patient who is in bad moods, that safety aspect of fighting or whatever, and the safety of the machine, so that moving the machine and so on. But when it comes to the procedure itself, the procedure is very friendly. It doesn't have any harm to the human body.
Okay, thank you so much. I think with the ultrasound, you'd notice that most of the question is just about pregnancy, and I think that has been, you've talked about it quite conclusively. Let's now move on to MRI.
MRI, that is another elephant in the house. As many of you know, MRI, in its initials, the fullness of it is magnetic resonance imaging. It is an old modality which started in the late 19th century, and it has been developed, and it is still being developed, still being improved, to be used for medical imaging, mainly for diagnostic purposes. You will find some people telling you that I don't want you to go to this particular area because I don't like the images from there. Again, it is all about the kind of a machine you are using. This is a magnetic field, a very strong magnetic field we are using. So you will, again, it also happens even in CT scan, even in X-ray. Remember I talked about doses. There are specific areas which require high doses. There are specific areas which require low doses. And there are specific machines which can only produce up to a specific dose. So you will find there is a machine which can do a knee, but it cannot do an abdomen because its strength is not to that level. Likewise, in MRI, we have strengths of a magnet. In physics, magnetism is measured in Teslas. So you will hear of people talking about 0.0 watt Tesla. Currently in this country, I think we have 0.3, 0.5s, which are very many, for basic MRI imaging. Then we have the 1 Tesla. We have, I think, 1 or 2 in the country. But quite a number of the average centers in this country have got a 1.5 Tesla. 1.5 Tesla is deemed to be an MRI machine which can basically do all the medical imaging magnetic resonance procedures without any problem. They can give you good quality imaging of all the MRI procedures. Quite a number of centers have gone further because of the continuous growth in technology to bring in 3.0, which is double 1.5 Tesla units. Yeah, they are super duper units. They will give you quite some blue chip imaging for some areas, but generally, with my experience, a 1.5 Tesla unit worldwide has been deemed to be the average unit for any particular center. And even right now, we have upgradable units because of this very spontaneous change in technology, whereby even in the IT world, and all these machines composed of quite a bit of IT, they have come up with an idea whereby you can upgrade your unit. Instead of doing away with the unit, you just upgrade the software. So with these upgrades that are available in the market, basically an 1.5 Tesla MRI is good enough for everything, apart from cardiac imaging. But currently I'm told there is a very new software in the market which on a 1.5 can do very good cardiac imaging. But anyway, cardiac imaging is not a very common, there is a lot of controversy on cardiac imaging because each and every person would want to do it their own way. Cardiologists will want to do a cardiac imaging in their own way. And even the same cardiologists, they are different cardiologists. They are interventional cardiologists who really want their profession is all about interventional. They want to go in. Interventional simply means they want to go in. So there is a lot of controversy in medicine, but all is geared towards therapy. Thank you.
Okay, thank you so much. And when we talk about MRI, then how different is it from these other technologies that use radiation, especially when it comes to safety and when it comes to the kind of images you get?
The difference between these modalities actually is very clear when you look at the nomenclature. Ultrasound deals with ultrasound. There is sound energy. Radiation, there is radiation energy. MRI, that is magnetism. But all these are put in one basket in something called EMR. EMR is electromagnetic radiation. If you go deep into electromagnetic radiation, then you will be able to understand that all these modalities come under that. So for MRI, we use MRI, the difference is actually big. And again, as I said, MRI is not your solution for everything. It has specific solutions for you. Don't send everybody, because that is the highest imaging modality. Don't send everybody who wants radiation services for MRI. Please understand and clearly find out what do you want as your diagnosis before you send a patient for a modality, medical imaging modality. To go through MRI, MRI is good for very specific areas. That is, areas which have a great amount of soft tissues and areas which have a high amount of hydrogen electrons. I know hydrogen electrons may sound complex, but to simplify, I feel like using the word fluid, but fluid again composes of air. So I want to use the word water. Yes. Any place where there is high amount of air, and the only place with high amount of air in a human body
is the lungs.
It's the lungs. MRI is not the preferred examination. Unless you have proved that now your patient, the whole chest is full of effusion, and if the whole chest is full of effusion, then I'm wondering how the patient would be living. Then you can do an MRI. but the best modality for that is CT scan. Give me a patient for MRI in special areas where there is water and soft tissue.
Mm-hmm. And Bwana Mutwasi, where you see many people who watch this particular broadcast, it's just general public. People really don't understand all this in terms of air and water. Maybe what are some of these a few things that I need to tell the doctor before I go through MRI? What are some of the precautions I need to take as a person before? Of course, I've been sent to the radiology department. What are some of the few things that you'd want a patient to tell you before you actually put them on an MRI machine? And also, maybe what are some of the now safety precautions from the radiographer's position or medical technologist position? What are some of these things you look at before you expose a patient to MRI? Apart from maybe the fluid and all that, any other maybe allergies or any other thing that you look at before you put them through an MRI machine?
Bwana MC, before I go to the safety measures in MRI, I think there is something I really want to explain. I'm trying to digest on how I need to put it to my viewer so that clearly I feel that they really need to understand more about MRI. First of all, I will try to be very simplistic in my explanation. What happens in an MRI is that an MRI is a huge machine which has got a tunnel, and around that tunnel is the live magnet we are talking about. So we actually put you in the middle of a magnetic field, a very strong magnetic field. Your body is composed of more than 75% of something called water. And water is all about hydrogen electrons. Hydrogen electrons are very sensitive to a magnetic field. So what happens when your body mass is put at the center of a very strong magnet is that the 75% of the hydrogen electrons of your body tend to align or tend to behave in a similar way. All of them. And different areas will have different accumulation of hydrogen electrons depending on the organs. Of course, the liver will have more hydrogen electrons than, let's say, a cartilage. Even a bone has fluid in it. So the bone will have very few hydrogen electrons. So you will find that you have a volume or a mass in a strong magnetic field with hydrogen electrons behaving in a particular way, but the concentration is also different in particular areas in that body. So now that you have a mass which has got electrons aligned in a particular way, there is what is called, you want now for you to do imaging, you want to interfere with that alignment. How do you interfere with that alignment? Now that is the very most important aspect of imaging, magnetic resonance imaging. In MRI imaging, there is three very important components. The magnet, and number two is what is called the radio waves. When you apply a strong radio wave on electrons that have been specifically aligned by a magnet, then those the radio wave interferes with that alignment. So, once you have applied that strong radio wave onto that alignment, they tend to move in a particular way. And remember, depending on the area, the movement will be different. Now, after that movement has happened, then you pick that signal. Once you pick that signal, the electronics in the system will do the analysis of the system and will construct an image. And that is what you see on the screen as your image.
So far you'd say that MRI is the most complicated way of getting an image.
Yes.
Okay.
Yeah, it is.
Does it mean maybe it's more, of course, if it's more complicated, then also its results are maybe more precise than the other methods?
I would say, as I said earlier, there is a lot of physics involved in this imaging. And the issue of the best and precise results will basically depend on what are you looking for. Fine, I will tell you, if you are doing a brain, because of the nature of the brain, CT scan will give you some results. You will be able to see a tumor in the brain. MRI will clearly define for you, or will precisely define for you that tumor, because of the anatomy, or rather the structure of the head and the brain. So, in places where we say that I want to look at this brain precisely, then if you have an MRI, somebody will tell you, go for an MRI.
Okay.
But now, that is, we have the head. There is imaging of the head. There are doctors who tell me, send patients to me, do an MRI of the head. Indeed, I'm not doing an MRI of the head. I'm doing an MRI of the brain. If you wanted to look at the head, as in the skull, I'll tell you no. The best imaging modality is the CT scan. Because the hydrogen atoms in the skull are very few, and they will not give you a precise image on an MRI. What am I saying? I'm saying MRI is not good for the bone. CT is good for the bone. MRI is good for soft tissue. The abdomen, abdominal organs, the pelvic organs. If you want to look at the soft tissue in the joints, if you want to look at the muscle tissue, MRI is the best imaging modality. If you want to look at the cord, that is the spinal cord, that soft tail that runs through from the brain, connects the brain to the body. It runs from the neck down to the pelvic area. That is the cord. It is a very sensitive area. Why is it sensitive? Because it connects the body to the engine. And the engine is the brain. Without the engine, you do not have life. So, any compression on that organ, on that part of the body, will have issues. What does it carry? It carries nerves. And nerves are all about sensitivity. Human body functionality is all about how it reacts to any stimuli. So, it's all about sensitivity. So, you will find 90% of the MRIs we are doing are all about the central nervous system. That is the brain and the cord. Whereby, in most cases, in between the spine of a human body, for it to be balanced, You see, it can't just be a straight bone. It should be able to have joints to move so that you are able to move back, front. So it has its joints, and those joints are what are called discs. Disc is like, it's not a bone, neither is it a soft, is it flesh, but it is like a cartilage. So it allows you to bend. You see, a cartilage is soft, it can bend. It allows you to bend either side. And because of the aging of the body, it will tend to lose its position. It can lose the position to the side, to the either side, left or right, or the front or the back. If it goes front, left or side, I'm not saying you are very safe, but you are a bit safe, rather than it going to the back. Because immediately it moves at the back, it will press on the spinal cord. And if it presses on the spinal cord, it interferes with your central nervous system. And that is why you hear a patient saying that I cannot feel anything on my right side. It's simply because that disc moved backward because of aging, or might be injury, or you lifted something heavy, then it moved. So it pressed on the nerve. And when it presses on the nerve, it tends to either completely or partially block the nerve. Hence, the nerve will not serve the destination. And that is why you hear a doctor telling you, your cord has been compressed. It can be compressed. In many cases, it is the disc. But at times, you can be involved in an accident, then there is a fracture of a bone, then that bone goes into the direction of the cord of the nerve movement, and it compresses on the nerve. So the best modality to use is you come for an MRI, then we will do a transsectional imaging of that particular area in different, from front to back, from left to right, from superior to from up to down. Then we can actually be able to know where specifically has been compressed on. And by so doing, then the surgeon can make a decision of now, do we decompress or how do we manage the ailment? Yes.
Okay, thank you so much for that. I think so much knowledge has been shared. Somebody here saying wisdom of matters pertaining imaging shared carelessly. Of course, different people talk differently, but then I can see that, of course, somebody there is happy. MC Calypto saying, getting you loud and clear. Tony saying, great insights from my senior colleague. Thank you so much. Kevin Nyausi saying, good morning, watching live from Eldoret, CBD. Anthropologist Chumba saying they are watching from Celia. Thank you so much for the many comments coming in. I can see somebody called Queen. She says, good morning. Thank you so much for making time to be with us. Of course, as we go towards the end of it, of course, somebody asking a question about MRI and insurance, or not MRI, but rather imaging and insurance. Why is it that so many insurances don't cater for these procedures? Then also, as you answer that, I think you've answered the issues of safety. Okay, I think it's only about insurance. Yeah.
Safety MRI we shall talk. It's very important that we talk about safety MRI. We haven't talked about that. But let me talk about insurance. Insurance is all about putting money somewhere in advance in case you get sick, notwithstanding the amount that is incurred during the treatment process. Then wherever you kept the money caters for your treatment when it comes to health insurance. These procedures we are talking about, starting from CT, MRI, going above, are not cheap procedures. And insurances, and the way you insure even your car, they will always make sure that the premium is minimally used. So they have to ensure that before they authorize you to do this procedure so that they pay later. Then they must clearly understand, is that procedure necessary? You remember in my discussion, I've really been talking about having the correct modalities for correct procedures.
Okay.
That is what the insurance is just trying to verify. Why do you want an MRI which is more expensive than a CT? Why do you want an MRI of the chest and CT is there? So they have to clearly find out. They have their panel of specialists who clearly understand these procedures. And some of these insurance, on insurance, I want to tell my patients, the public, that when you are taking an insurance cover, please understand your insurance cover. Not all insurance covers cover everything. There are insurance covers which will tell you we will not be covering CT and MRI. So please understand your insurances. But also if it is comprehensive, they will make sure that they only pay for things which were necessarily done. That is the reason why there is what is called pre-authorization. When an insurance has to do a pre-authorization, it has to make sure that they are pre-authorizing the right procedure. Don't ask me that, but a doctor has seen me and deems it fit. There is nobody who is a custodian of any particular part of knowledge. So, in one way or another, we do wrong things as we work, as we carry out our professional duties. At times, there is a lot of misconception. There is a lot of misbelieving that this is the right procedure when we don't have that knowledge. And that is why we say learning is a continuous curve. So I don't see, in fact, as we move forward, because this health is becoming more and more expensive, I see a situation whereby insurances are going to become more and more difficult. I don't see a soft spot coming in very soon.
Maybe we'll start having insurance that only covers diagnostics as a different part of maybe medical insurance. Anyway, because of time, I think we'll quickly go into safety precautions for MRI. I can see my directors already telling me that we're running out of time.
Now, I might use less than 5 minutes to talk about MRI safety measures. There is that aspect of allergy in MRI, so that is a safety measure. We must ensure that there are safety measures in case of an allergic reaction, and any patient who has an allergy, we have to note that so that we put in place all the necessary safety components. The most important thing in MRI is when we ask you if you have ever had surgery or an injury where metals have been involved. Remember, we are talking about magnets, a very strong magnet. And everybody should be understanding why I don't want you to go into an MRI room
with a metal.
With a metal. So I have to ensure that before you go into an MRI room, you don't have a metal. You don't go into an MRI room with a patient on a stretcher which is going to be pulled by the magnet to bring in another disaster. I have seen situations where patients have died. We have special stretchers, we have special wheelchairs, we have special monitors which are allowed to go into the room, and those equipment are made of metals which are non-magnetic. Currently, we have surgeries which are done whereby you have a fracture, they put in metals. The metals that are being put in are metals which are non-magnetic. But there are some areas which are using structures which are not magnetic. That is why when you come for an MRI and you have had a surgery where a magnet has been put in, a pacemaker has been put
metal
in.
Rather.
Yes, you have a metal, you have a foreign body in your body. Ladies, don't worry with your copper T. Copper T is non-magnetic. So, it is very dangerous to take in a patient in a very strong magnet with a component which you are not sure if it is ferromagnetic or magnetic. So that one is a very strict aspect of MRI, because once that happens, then I will have to stop the MRI service and I will have to stop the magnet, and that magnet will have to be replaced at a point. because this is not a magnet that is a metal that is just magnetic. This is a magnet that has been powered by an electric solenoid. So please understand that on the issues, the most important aspect is, do you have a metal in that vicinity or not? So for you to go in, before I open for you that door, I will have to ensure that your safety, my safety, and the safety of the machine is 100% taken care of. That unit is hundreds of millions of shillings, and any peak of carelessness can cost that machine. So on that, we do not have compromise. Thank you.
Okay, thank you so much. Of course, we've been with Oscar Mutwasi, who is an imaging technologist, or rather a medical imaging technologist from Tophil Hospital. Of course, if you've been tuned in, and then of course you've actually gained a lot of knowledge. Nonetheless, if you're just joining us, the goodness of social media is that the link remains there and you're able to go and review it later. So I'll give you a chance to give your parting shot, of course, to our viewers.
First of all, I would want to thank my host today for just allowing me this time to come and share this knowledge, because knowledge is good when it is shared. Knowledge concentrated at one place doesn't add any value. And I really appreciate because you chose on this topic. This is one topic that has really been neglected all over, and it's now that quite a number of people are now recognizing that radiology is a powerhouse, and I really appreciate that. By the way, just for your information, to prove this point, late last year, the Parliament has allowed the profession to take care of itself, just the same way as lab takes care of the laboratory technology takes care of themselves. They have a body which ensures that everything is running in the correct way. And we are a profession that is the Society of Radiography in Kenya. We are in the process of putting in place body that is going to ensure that things are going in the right direction as far as medical imaging practice is concerned in this country. Thank you very much. Thank you very much for the institution I work for. And thank you, my viewers. I do really appreciate the support you have given us, and I'm sure as we move by, we shall be interacting.
Okay, thank you so much also for making time, Mr. Mutwasi. Mr. Mutwasi is an is a medical imaging technologist from Tophil Hospital. As I said earlier, Tophil Hospital is situated in Elgonview at a place just around Boma Inn. I don't know if you're coming from a Kisumu Road, that is a Eldoret Kisumu Road, then around Nairobi Road, then you'd see a signpost there. If you're coming from Nairobi, at just past Poor Place, there is a signage there. If you're going through MTRH around the temple there, there is a signage. So there are so many ways of accessing Tophil Hospital. Of course, if you're going to if you're going to use a motorbike, or you're going to use public service, then so many of them know where Tophil is. If you're using a private means, just ask for Tophil or Boma Inn, and around that area you'll be able to access Tophil Hospital. With that, this has been the Morning Glory. Remember that we are the most comprehensive talk show in Kenya currently. So if you've been tuned in, thank you so much for always making time to be with us. Tomorrow, see you on the family and relationship segment. For now, we've been coming live from Dawi Africa Photography, and on behalf of everyone who made sure that this broadcast goes on air, thank you so much, and God bless you.
Karibu Tophil Hospital, a brain and spine specialty hospital dedicated to providing extraordinary care through competent doctors and other medical personnel from premium institutes with knowledge on the latest and exceptional medical technologies. With a capacity of over 70 operational ward beds, over 30 specialists and consulting doctors, Tophil Hospital is a modern level 5 facility equipped with 12 state-of-the-art ICU HDU beds and 2 modern HEPA-filtered theaters with laminar airflow. Our aim is to provide comprehensive quality services at an affordable cost to the community, which includes but not limited to neurosurgery, radiology and diagnostics, MRI, CT scan, X-ray, ultrasound, endoscopy, ECG, EEG, pediatric cardiology, physiotherapy, orthopedics and trauma, pharmacy, laboratory, theatre, ICU and HDU, obstetrics and gynecology, general surgery, maternity, psychology, psychiatry, comprehensive wellness checkup, dialysis and urology, oncology, dental care, ENT surgery, nutrition and dietetics. For ease of movement and transfer of patients, the hospital has 2 modern critical care ambulances equipped with ICU facilities and available 24 hours. Tophil Hospital is located in a serene environment away from noise and has a cafeteria with fresh, nutritious foods, not forgetting ample parking for all clients. Tophil Hospital is NHIF accredited and accepts medical covers from a number of insurance companies. If you're looking for the best customer care and patient experience and to be attended within the minimum waiting time possible, reach us through the website www.tophilhospital.com or call 0782 121214, or you can also call 0782 900090. You can also email us through info@tophilhospital.com. Tophil Hospital, exceptional technology, extraordinary care.